So for this artery which we are discussing, we are talking about what is known as the anterior ulnar recurrent artery. Anterior ulnar recurrent artery. I told you guys that anytime you see recurrent, it's like something is going backward. From front is going backward. Okay, usually a branch. All right. So let's pick it up from here. So this is anterior ulnar recurrent artery. I have it there. So just so you know, it's a small branch. I tell you, it's always a branch. So it's the ulnar artery that usually gives it off in the forearm. So it ascends towards the medial side of the elbow. So it actually supplies muscles that are around that side. Okay. So usually around the elbow joints, anything around the elbow joints usually contributes to the supply. So it arises from the ulnar artery just distal to the elbow joint, and it's usually near the level of the pronator teres muscle. So what's the cause? It runs upward and medially towards the anterior aspect of the medial epicondyle of the humerus. It travels through the brachialis and the pronator teres muscles. Okay, so let's pick the artery again. This is the anterior ulnar recurrent artery. Okay, so clinical notes. Okay, no. We'll actually jump some aspects. So for the branches, muscular branches, it supplies the brachialis, pronator teres, flexor muscles of the forearm. Articular branches contribute to the vascular network around the elbow joints. So anastomosis with inferior ulnar collateral artery, other recurrent arteries around the elbow. Okay, then also forms part of the blood network that is around the elbow. So clinical notes. We study this artery because we want to know about the collateral supply. That's that network of arteries around the elbow. How are we able to know about the blood supply around the elbow? Then surgical relevance. You have to consider it if there's any surgeries that will be done around the elbow. Okay, you don't want to injure it. So you should know that the size and the prominence varies from one human being to another.